Recreational and medicinal marijuana use is becoming increasingly more common as more states legalize the drug, like California. And with this, more and more women are using marijuana in pregnancy to help with symptoms like nausea, vomiting, anxiety, and depression. But is it really safe for mother and child? Dr. Mitchell Goldman from UCSD is here once again to talk about all this. Dr. G, thanks for being here.
Great to be here, Kathleen.
Well, this was news to me. How many women are turning to marijuana during their pregnancies?
Well, estimates show that upwards of 4% of pregnant women are using marijuana to mostly stem nausea in the first trimester of pregnancy. And we know that in the first trimester, even in the first 4 weeks of pregnancy, that's when the fetal, your baby's brains are developing. And so using marijuana in that time is going to really affect the development of those young kids.
So what are the studies suggesting that the risks specifically are to the baby?
The risks are basically have to do with the frontal lobe, or that's the part of the brain that goes for decision making. And so what they have found is that children born from mothers who have smoked marijuana during pregnancy or taken the drops or eaten marijuana will actually have a number of different problems like impulse control, visual memory problems, and of course attention deficit disorder. Studies have also shown that these children are more anemic and are of a lower birth weight, and so there's lots of problems. Now, the big problem is that many young women between the ages of 18 and 25, upwards of 8%, use marijuana on a weekly basis. And so if those women get pregnant, and oftentimes they won't know if they're pregnant for the first month, they're already going to expose their babies to marijuana. So it's very, very important if you're an adult, if a young woman, if you want to get pregnant, now is not the time to smoke marijuana, and it's not proper to smoke marijuana if you're having that first trimester nausea.
Are there any side effects for the mother?
Well, no, and that's the thing is, as an adult, it's actually, we don't know how bad marijuana is. Of course, there's some bad things, but by and large, an adult can tolerate marijuana. But as we've said on this show many times before, teenagers with developing brains, again, marijuana basically disrupts the way the brain cells are working, and especially in the frontal lobe, which is our decision-making lobe. And we also know now that in fetuses, babies that are growing inside of your mother, that's also a time when you do not want to be exposing that fetus or baby to marijuana.
So, Dr. G, to your knowledge, are physicians or OBGYNs having these discussions with their patients? And do you think some recommend marijuana use for women who are suffering from terrible morning sickness and things of that nature?
Actually, no. The American Academy of Obstetrics basically put out a warning last year telling all of the doctors that no, it is not safe under any circumstance for women to be using marijuana in pregnancy. The problem occurs that, you know, in the states that have legalized marijuana either for medicinal or recreational use, there's no warnings for pregnancy. So just like in cigarettes, there's a warning, do not smoke cigarettes or do not drink alcohol, you're going to have problems with the developing baby. No state has yet developed warnings for medicinal or recreational marijuana for pregnancy, and that's the problem.
All right, Dr. G, some really interesting insight into this issue, and of course it sounds like warning labels might be just another facet to the many things surrounding the recreational use and legalization of marijuana that is to come.
Just making this aware is what's really important.
All right, thanks, Dr. G. We'll see you next Tuesday.
Thanks, Kathleen.